Hello, my name is Skylar. I am going to do a wound dressing change on my patient. I've already checked their chart, so let's go and check on their patient. Hey, Mrs. Jones. My name is Skylar. I'm going to be your nurse today. I'm going to check your wristband. Can you state your name and date of birth for me? Okay, thank you. I've already checked your chart and you're not allergic to anything. Are you in any pain right now? No? Okay, I'm going to check the integrity of your dressing, okay? All right.
The paper said right here. Yes.
It's a good time to do your dressing change. All right, I'm going to go and get my supplies, okay? I'm going to lift your bed up to working height and I'm going to lower
While I'm
your
checking the integrity of the wound dressing, I would also check to see which type of supplies I needed to use for this dressing.
Camera. Can you see that? Yeah, I can see it. You like it in there? Hello, I'm Catherine. Did you run?
Do hand hygiene. I'm going to pull the blanket back so I can see your wound.
One, two,
Okay, my name is Jess. I'll be doing position today. I'll be positioning my class from supine to lateral. I've accessed the risk factor to the triangle.
In a clinical setting, I wouldn't reach across my patient to grab the remote. And I also want to reiterate that I would already washed my hands and provided privacy for my client.
was that bad? Okay. It's you running. I gotta be
Alright, I'm going to take this off.
I deleted it. Good. 1, 2, 3.
Okay, we started.
I come on, Nasdaq on, because you goofy, man. Alright, look.
Alright, I'm going to take the packing out now.
Alright, go.
Jasmine, I'll be doing positioning today. I'll be positioning my class for supine. I've accessed the class medical records. I've assessed the risk
If the gauze was stuck, I would have done it first before I took it out. And I'm going to take my gloves off.
You down to the drainage. You got the paper in your face.
I would perform hand hygiene first.
See what I want to see, bro. Say what I want my client is with. You better cut that in part out. You just say something about inspecting your client. Yeah, I will also put a
Little blue pad underneath your leg, okay?
just say that part when you get to going through. Yeah, just be like,
And I'm just going, can you help me to position your legs so it would drain a little bit better?
yeah. Like, huh?
And now I'm going to irrigate the wound. Irrigation. I'm just gonna hold that underneath the wound as I irrigate.
As I prepare to irrigate the wound, I'd fill a syringe with solution and instill it into the wound without touching the wound directly. I would also hold the emesis basin close to the client's body and catch the solution as it drains from the wound. I would repeat this process until the drainage solution seems clear,
That I've irrigated
while
the
making sure to
wound
tilt
and
the
measure it.
client towards the basin.
It's gonna be about 5 inches wide, about 2 inches, about 2 inches deep.
Here I'm drying the wound, making sure not to go over anything that I've already dried, as not to contaminate the wound.
Alright, I'm gonna perform hand hygiene and put on another pair of gloves.
And I also have 2 to 3 assistants that could come and help me if needed, but my patient is able to help.
Alright, I'm gonna get ready to clean the wound with my alcohol.
After I measure the wound, I'm going to dispose of any of drain solution, soiled equipment, and linens, remove my gloves, and wash my hands to change the dressing.
It dry for a minute and then I'm going to pack it.
To clean the wound, I'm going to use an antimicrobial agent and use a technique that prevents transferring microorganisms back to a cleaned area as demonstrated. I'm also going to use a single swab stick or a small gauze square for each stroke, and I'm going to allow the antimicrobial agent to dry fully before placing a moistened 4x4 gauze in the wound bed and then covering the wound with the gauze dressing and an abdominal pad.
Now I'm going to put the dry clean dressing on top of the wound.
To pack the wound, I'm going to place moistened 4x4 gauze in the wound bed, then cover the wound with the gauze dressing and abdominal pad.
And I'm going to initial the wound. I also need to put the time. Alright, I'm going to cover my patient back up now, make him comfortable. Throw my stuff away before I take off my gloves. I'm going to go throw this trash away into the appropriate receptacle. When I did that, I took off my gloves and performed hand hygiene. Here's your call light. I'm going to put your bed back down to the appropriate level. Bed rolls up. Do you need anything? Are you comfortable? Okay. Do you need your phone and some water? All right. Thank you, Ms. Jones. Okay, now I'm going to go document my wound care.